Every day in this country, thousands of seniors take a small pill to control their blood pressure, never knowing that pill is also quietly putting pressure on something else entirely, their kidneys. The kidneys are the body's filtration system, and they run almost entirely on blood flow and pressure. So it makes sense that the very drugs designed to control that pressure can, under the wrong conditions, end up starving or straining the organ they were never meant to touch. I'm Dr. Sarah Bennett, and in my years working alongside patients managing hypertension, I've seen this exact pattern again and again. Someone's blood pressure numbers look perfect on paper. Then a routine blood test comes back and their creatinine has crept up, their kidney function has slipped, and nobody connects it to the prescription bottle they've trusted for years. It's rarely one bad pill. It's almost always a combination, a dose, or a missed warning sign that built up quietly over time. Today I'm walking you through 7 blood pressure medications and combinations most closely tied to kidney damage in older adults, counted down to the one I consider the most dangerous of all. Watch for number 1, it's a combination sitting in millions of medicine cabinets right now, and most people taking it have never been told what it's doing. Before we start, tell me in the comments which blood pressure medication you're on and how long you've been taking it. I read every comment, and it shapes what I cover in future videos. Let's start at number 7. Number 7 is the loop diuretics, and the name to know is furosemide, sold as Lasix. These are powerful water pills, often handed to patients with both high blood pressure and heart failure because they're excellent at flushing excess fluid out of the body fast. That speed is exactly the problem. Loop diuretics can pull fluid out faster than the body can adjust, and when that happens, blood volume drops sharply. Less blood volume means less blood reaching the kidneys, and the kidneys respond to that drop in flow by slowing down. In an older adult who's already a little dehydrated, sweating through a hot day, or fighting a stomach bug, that drop can be enough to tip the kidneys from working fine into acute injury within days. The warning signs are simple: dizziness when standing, unusual thirst, dark urine, or noticeably less urine than normal. If you're on furosemide, staying properly hydrated and having your kidney function checked periodically isn't optional, it's the whole safety net. Never stop it on your own, since the fluid buildup it's controlling can be dangerous too, but flag any of those warning signs to your doctor right away. Number 6 is the thiazide diuretics, most commonly hydrochlorothiazide. These are gentler than loop diuretics and often the very first medication prescribed for high blood pressure. They work well and they're generally considered safe for the kidneys at normal doses. The risk shows up with long-term use, especially in combination with other blood pressure drugs. Thiazides can gradually shift the body's sodium, potassium, and calcium balance. Electrolytes the kidneys themselves depend on to regulate fluid and filter waste properly. Over years, especially in someone not drinking enough water or eating enough potassium-rich food, that slow electrolyte drift can put a quiet, ongoing strain on kidney function. It rarely causes a dramatic event. It's more of a slow erosion that shows up as a gradual decline in kidney lab values nobody traces back to the pill. If you've been on hydrochlorothiazide for years, ask for a basic metabolic panel at your next checkup. It's a simple blood test that catches this early, long before it becomes a real problem. Number 5 is the ACE inhibitors, the family that includes lisinopril and enalapril. These are some of the most prescribed blood pressure drugs in the world, and for most people, they're actually kidney protective over the long run, which is why they're often the first choice for patients with diabetes or early kidney disease. The twist is in how they work. ACE inhibitors relax the tiny blood vessel that lets blood leave the kidney's filtering unit. That's usually a good thing. It is, until something else also drops blood flow into the kidney at the same time, like dehydration, a stomach virus, or a missed meal in the heat. When that happens, the same mechanism that normally protects the kidney can cause a sudden, sharp drop in filtration. This is why doctors will often pause an ACE inhibitor temporarily during a serious illness, a surgery, or a bout of vomiting and diarrhea. It is also why a kidney function blood test, usually done a week or 2 after starting the drug, matters so much. If you're on lisinopril or enalapril, know this. Any illness that causes vomiting, diarrhea, or poor fluid intake is a reason to call your doctor about whether to temporarily hold the dose, not push through it. Number 4 is the angiotensin receptor blockers, or ARBs. Losartan and valsartan are the names you'll see most. They work through a similar pathway to ACE inhibitors and carry a very similar profile. Generally protective for the kidneys long term, but vulnerable to the exact same dehydration trap. The reason ARBs are often prescribed in place of ACE inhibitors is that they don't cause the dry cough some people get, but the kidney mechanics underneath are nearly identical. The same rule applies. Stay hydrated, get your kidney function checked periodically, especially in the first few weeks after starting or after a dose increase, and treat any illness involving fluid loss as a reason to call your doctor about your dose. Number 3 is where it gets genuinely dangerous, because this one isn't a single drug, it's what happens when an everyday painkiller meets your blood pressure pills. Number 3 is NSAIDs taken alongside ACE inhibitors or ARBs. Ibuprofen and naproxen, sold as Advil and Aleve, sit on every pharmacy shelf with no prescription needed, which is exactly why almost nobody thinks twice about taking them for a sore knee or a headache while also managing their blood pressure. NSAIDs work by blocking a different part of the kidney's blood flow regulation than ACE inhibitors and ARBs do. Taken alone, that effect is usually minor. Taken together, the two drugs attack the kidney's blood flow control from two different directions at once, and research has linked this combination to a meaningfully increased risk of acute kidney injury compared with taking either drug alone. The danger climbs further if a diuretic is added into the mix, which brings us to the real heart of this list. Number 2 is that exact 3-drug combination, known in medicine as the triple whammy. It's a diuretic, an ACE inhibitor or ARB, and an NSAID, all three together. Individually, every one of these drugs has its place and its own safety profile. Stacked together, they each pull on the kidney's blood flow regulation from a different angle, and the combined effect is far greater than any one of them alone. A large nested case control study published in the BMJ found that patients on this triple combination had roughly a 31% higher risk of acute kidney injury compared with patients taking just the diuretic and the ACE inhibitor or ARB without the NSAID. A more recent systematic review pooling data from over 400,000 patients found the risk of acute kidney injury was roughly double in people exposed to this combination. And acute kidney injury itself is not a minor event. Studies estimate it carries a fatality rate of around 10% in the general population, climbing dramatically higher in patients who are already seriously ill. What makes this combination so common is how invisible it is. A patient gets a diuretic and an ACE inhibitor from their primary doctor for blood pressure, then picks up ibuprofen at the pharmacy for a sore back, with nobody in the chain stopping to flag that the three together change the equation entirely. If you're on a diuretic and an ACE inhibitor or ARB, the single most important habit you can build is reaching for acetaminophen, sold as Tylenol, instead of ibuprofen or naproxen for everyday aches, and checking with your pharmacist before taking any new over-the-counter pain reliever. Number 1 is the one most people taking it have never been warned about by name. Number 1 is aliskiren, sold as Tecturna, combined with an ACE inhibitor or an ARB. Aliskiren works through yet another point in the same blood pressure regulation pathway that ACE inhibitors and ARBs use, and for a while it was prescribed alongside them on the idea that hitting the pathway from multiple angles would control blood pressure more tightly. The data told a different story. Combining aliskiren with an ACE inhibitor or ARB was found to significantly raise the risk of kidney problems, along with high potassium levels and low blood pressure episodes, particularly in patients with diabetes or existing kidney disease. The risk was serious enough that regulatory agencies issued strong warnings against this specific combination, and it's now something most kidney specialists actively avoid prescribing together. The reason it sits at number 1 on this list isn't that the drug itself is rare. It's that the danger is concentrated entirely in one specific pairing, and a patient who started on one of these drugs years ago, then had a second added later by a different doctor, may have no idea the combination itself is the problem rather than either drug alone. Here is the thread that runs through every item on this list. None of these 7 things make a case against blood pressure medication. Uncontrolled high blood pressure is, by a wide margin, more dangerous to your kidneys, your heart, and your brain than any of the drugs used to treat it. What actually causes harm is the layering. One more pill added here, an over-the-counter painkiller picked up there, a stomach bug that goes unmentioned, and nobody in the picture adding it all up at once. The fix is almost always the same. Bring every medication and supplement you take, prescription and over-the-counter, to one appointment and have your doctor or pharmacist go through the full list together. Ask specifically whether any of your blood pressure medications fall into a risky combination. Get a basic kidney function blood test at least once a year if you're on any of these drugs, and immediately after any new one is added. And build the habit of reaching for acetaminophen instead of ibuprofen or naproxen for everyday pain, since that one substitution alone closes off the most common path to real damage. Now I want to hear from you. Which of these medications are you currently taking, and has your doctor ever specifically warned you about combining them? Tell me below, and tell me you'll bring your full medication list to your next appointment. It might be the conversation that protects your kidneys for the next 20 years.